Let's talk infection 3 to 4 weeks after you've taken out your patient's third molars. What? Your patient calls you in a mad panic 4 weeks after you've taken out their third molars and there was uneventful healing. Then you see them and they look like this. The patient thought you were a hero, turns out you're a bum. But what happened? What could it be? So this happened to me yesterday, so I thought I'd talk to you guys about it today. We call this a subperiosteal infection, meaning infection below the periosteum of the flap. But how? 2 reasons come to mind. 1, the obvious. Was your patient eating something they shouldn't have? I told her not to eat popcorn, but she just didn't listen. And number 2, did you rinse your site? Taking out the tooth is half the battle. You still have to make sure that the patient heals. Suturing is one component, which we spoke about in another video, but we have to make sure we rinse the flap really well. And use an entire monoject syringe and rinse the surgical site with saline. And I didn't say socket, I said surgical site. This means rinse the socket a bit, make sure it's still bleeding, and make sure it's clean, but we want to rinse our flap really well. Make sure there's no debris or small little tooth fragments or bone chips left behind, and just make sure the flap is clean. And this is huge. You can't skip this step. You want your patients to heal faster, don't you? Well, then just don't forget to do this. To treat a subperiosteal infection, I always start with a combination of amoxicillin and metronidazole. After all, we have to kill the anaerobes in this site. Usually the soft tissue is closed. It looks great. You did a good job with the surgery. But now you have swelling and there's just no access, and it's the anaerobes causing this swelling, and that's why we want to use metronidazole. Along with the antibiotics, I usually anesthetize the patient, reopen my flap, debride the area, and irrigate that flap with saline really well. This always does the trick. You better watch out for subperiosteal infections. Just when you think you're a hero, the dental gods smack you down to earth. Sorry, man. Dentistry is humbling. I hope this helps. Let's get through the rest of the week. Have a great day.